If feeding feels nonstop, confusing, and honestly a little overwhelming, this video is for you. In this video, I'm gonna help you understand what newborn feeding behavior actually looks like in those first few weeks, whether you're breastfeeding, formula feeding, or doing both. A lot of newborn behavior is normal, no matter how your baby is fed. Usually we see differences when we talk about milk supply, latching, and bottle technique. Before we start, I wanna go over a couple of very important points. If your baby's a preemie, very sleepy, jaundiced, hard to wake, not feeding well, losing too much weight, or having fewer wet diapers than expected, those babies need special individualized plans and earlier follow-up. Save this video. You're gonna want it later, especially when it's 2 a.m., it's chaotic, you're second guessing everything. This video is here for clarity. Moms constantly ask me, why does my baby want to eat again? Didn't I just feed them? If you've had that thought at 2 a.m., you're not alone. And more importantly, you're not doing anything wrong. Most newborns feed often in the first few weeks. For many newborns, that means at least 8 to 12 feeds in 24 hours, sometimes more. And let me tell you, that can feel non-stop. It can feel like something is wrong, but here's what actually is happening. Newborn stomachs are small. Babies digest milk quickly, and newborns often do better with smaller, more frequent feeds. If you're breastfeeding, frequent feeding also helps build milk supply. The more milk removed, the more your body gets the signal, make more milk. If you are formula feeding, the same early hunger cues still matter. The difference is that with a bottle, you can actually see the amount taken in, and babies often go a little longer between feeds. But the big idea is the same. Frequent feeding in the first few weeks does not automatically mean failure. A lot of times it means your baby is doing normal newborn baby things. Now, I wanna go over timing your baby's feedings. Very important topic. First, don't stare at the clock all day and panic over every gap of time. Watch your baby, and remember, some babies feed every 1 to 2 hours for stretches, some go closer to 3 hours. Both can be normal. If your baby's bottle fed, many newborns eat about every 2 to 3 hours early on. In the first day or two, they may only take around half an ounce to 2 ounces per feed. And after the first few days, many take about 2 to 3 ounces every 3 to 4 hours. Here's the safety caveat. In those first few days and weeks, if your newborn is very sleepy and is not waking to feed, do not let them disappear for long stretches of time. We're talking about several hours, 4 or 5 hours. Don't let them disappear for that time. If a newborn is sleeping longer than about 4 hours and not cueing to eat, wake them and offer a feed. So what helps? Keep a simple note on your phone for the first week or two. What you want to do is you want to track the feeds, wet diapers, dirty diapers, and weights when you have them. If bottle feeding, track about how much your baby takes, but don't force them to finish the bottle just because there's milk left. The key is not to obsess. We want you to zoom out and see the trend. One short feed is not the whole story, the pattern is. Crying is usually a late cue for feeding, and furthermore, it makes it harder for baby to feed. Remember, the goal is to pick up on those earlier hunger cues and don't let your baby get to the point of crying, so that way feeding can be much calmer, easier, and you're likely to be more successful. Let's say your baby's already crying though, and hungry, and pissed off, and just won't feed. First thing is, don't force baby, and that applies whether you're using feeding by bottle or by breast. Your first job is to help that baby settle down enough so that baby can feed properly. What helps the most and why? The first tactic you can use is skin to skin, baby against your bare chest. This has the best breastfeeding specific evidence in this group. It lowers stress, helps regulate temperature and heart rate, and supports early breastfeeding behaviors. Plus, you can also use it to help formula-fed babies calm down before their bottle. Tactic number 2, gentle rocking or walking. Rhythmic motion helps lower arousal and can make crying baby kind of less disorganized, more calm. And when they're more organized and more calm, they tend to latch better, suck better. The evidence here is more about calming the baby than direct feeding success, but it should make sense though, because a less distressed baby tends to coordinate better, tends to suck better, latch better, feed better hopefully. The third tactic is soft shushing or steady white noise. This gives a repetitive sound input to help reduce that sensory overload in your baby and help support them in settling down. Again, this is more better evidence for calming them down rather than feeding them itself. Another tactic is swaddling. And it's really to help them settle again before you try again. A contained baby may calm down faster. However, this should be short and practical, not prolonged. You want to use it as a bridge to feeding, not as a replacement for feeding. Another tactic, letting them suck on a clean finger briefly to help, again, organize their mind, calm them down. And remember, sucking is one of the earliest self-soothing mechanisms a baby will do as part of their state regulation behavior, meaning to help regulate their mind. So parents, if you want to just remember one thing, use skin to skin first. That's the most evidence-backed option and usually the gentlest. Remember, once they are calmer, not necessarily silent, just less frantic. Once they're less frantic, try feeding again.